Good morning, everyone. We'll give it a few more minutes just to let other people jump on the call. Thank you for joining us. Feel free to share this with other people while we're waiting and see if they're interested in joining as well. Welcome everyone to this morning's community cafe. It'll be on self-help. We've got a couple speakers today, and I want to make sure everybody understands this is interactive. So feel free to put your questions in the chat box, or if you're comfortable, turn your screens on and we'll open it up when there's opportunity for Q&A, and you can speak to the presenters. So whichever you prefer, we'd love to see your smiling faces as we go through this. So again, welcome. My name is Jerry Campbell with Partners Health Management. We'll go ahead and get started. Our first speaker is Brandy Lineberger. She's our population health manager, and she's also a registered nurse. So with that, Brandy.
Good morning, everybody. I hope y'all are having a really good morning. It's bright and sunny outside. Don't know if anybody's had a chance to get out and take a walk this morning yet, but if you hadn't, better do it before lunchtime because it'll be, 100 degrees by then, right? So if anybody has any questions or comments as we go along, feel free to put it in the chat, or I'm totally okay with you coming off mute as well, and I'll be happy to answer any questions. So we're going to jump right in. I am a registered nurse here at Partners, and I work on our population health team. And so just quickly to tell you a little bit about population health, we look at the health of various populations, and we look at ways that we can help to provide them knowledge and information and tools to be able to work on prevention and wellness. So we try to provide information on any type of subject that might be related to a specific population. And with that being said, part of that is men's health. So it is Men's Health Awareness Month. And so we wanted to jump in and give some tips and tools and things to put in the toolbox to be able to help the men that we love that are in our lives to be healthy. So with it being Men's Health Awareness Month, the month of June, we do want to talk about some things. And today, these are our objectives. So what I'm going to talk about and help you all to become familiar with is how to stay on track for the best health possible. We'll talk about some of the leading health issues that men face. We're going to talk about preventative testing and screening that's important to males, and then also how to lead a healthy lifestyle. Now, what I will tell you is, as far as leading a healthy lifestyle, many of those tools and tips that I give you can be applied to anyone's life. So feel free to take notes and jot down things that you can apply to your own life. Staying on track for good health. It's really important that we have an annual wellness visit every year with our physician. We want to make sure that we do that. You want to get those important screenings completed. You want to ask your doctor about any kind of vaccinations that might be important to you or immunizations. There are, various vaccinations that are important at different stages of your life. And there are some that are particular to males and females. So those are things you might want to ask your physician about when you go in. I'll also touch on this. I think it's important that when you're choosing a physician, that you make sure it's somebody that you can have a really good relationship with. You want to make sure it's somebody that you can talk freely with, that you can tell them how you feel. You can tell them about any symptoms that you might be having. You can tell them about how you're feeling as far as with your mental health, how you're feeling socially. All of those things are very important to make sure that you're the best you can be. Want to make sure that you're eating a healthy diet. So a lot of people are like, okay, I hear so many things out there. There's all these fad diets, at any point in time you could hear, I'm keto, I'm low carb, I'm doing Weight Watchers, Jenny Craig, all of those things, right? So there's all of these dietary choices that an individual can make. And so what I always say as a nurse, the best thing to lean on is just looking at your plate, right? And making sure that it is varied. So you don't want to have a ton of one item, right? You want to have a very wide spread of food. So you want to have color, right? So you want to have your purples, your greens, what we consider your blues. We want to have your reds. All of those things are very important. You want to have proteins. You want to have healthy whole carbs. So you want to have whole grain things. So one way you can do that, if you're going to eat, let's just say maybe pasta, for example. We know pasta generally in a large amount is not that healthy for us, but if you choose and you decide to eat pasta, you could have a smaller portion, right? And use whole grain noodles or whole wheat noodles. So that could be a better choice for you. But just making sure that you have your fruits and your vegetables. Water, and it's so hot outside right now. It's super important to make sure you get enough water. On any given day, most of our population walks around dehydrated. That can lead to dizziness. It can make you have headaches. It can make you have muscle cramps. And overall, it can just make you feel blah. So you might have inability to focus, just not feel well. So making sure you stay really well hydrated is important. Leading an active lifestyle. So what does that look like? Could be different for everybody, right? So some folks might say, well, I run 4 miles a day. Well, I can tell y'all, if I'm running 4 miles, y'all better be running too. Something's probably chasing me. I'm not a runner, but what I do like to do is maybe walk around. I live on a farm, so I like to walk around the farm. I do like to get out in the woods and see what's out there. I like to ride a bike that I have inside that's a recumbent bike. That is an okay activity for me. But an active lifestyle doesn't have to be exercise, right? It could just be getting out and doing active things. So it might be being active in your community. It could be, leading a healthy social lifestyle. So being active socially. It could be that maybe you're more of a personal, private person and you like to be at home in your little nest and you want to watch movies. That's still considered having an active lifestyle because you're engaging your mind and your body and things. So that's really important. Self-care, cannot say enough about self-care, and I'll actually touch on some self-care towards the end of the presentation, some ways that we can have self-care. Especially with our males in particular, sometimes they're so busy doing things for everyone else and working and in the community doing things that they forget to practice that regular self-care. So we'll touch on some ways that that men in particular can practice really good self-care. And then having an awareness of your mental, your social, and your emotional health is really important. And sometimes I know that males may struggle with that. So, what does that look like? What does having an awareness of your mental, social, and emotional health look like? It could, be anything from just being aware that, okay, I'm starting to fall into some things that are not healthy for me. So I'm staying up later at night, not wanting to get up in the morning. I'm not as motivated to do the fun things that I like to do and be engaged with my friends and having a healthy social life. It might be that someone might be having some emotional feelings that they're not used to having. So just having an awareness of that and making sure that when you see those things happen and that you take action and that you don't stay in that situation for too long. And so now I want to talk about some of the leading health issues for men. As many of us know, heart disease as a whole is a leading health issue for our population in the United States of America anyways, but it is also one of the leading health issues for men. It is actually the #1 reason for death in men. So that is, that one's on the top of the list there. And it's important to note, since, I have worked in mental health, behavioral health, substance use, and intellectual and developmental disabilities for a great portion of my career, mental health is associated with the risk factors for heart disease. So it's important to make sure that as a man that you are, addressing mental health and make sure that you're mentally well. And if not, that you're seeking help with that to make sure that you can be as mentally well as you possibly can be. And then another leading health issue that I want to talk about is prostate health. That is actually one of the leading causes of death in men is prostate cancer. And so the very key to preventing is screening and early detection. And we'll talk a little bit on the next slide about what that means. But it's really important to make sure that you're having those screenings and that you're talking to your doctor at your annual wellness visit about what testing, what screening is important for me. What do I need to have done to make sure that I stay as healthy as I can be? So some important preventative testing and screening for men. It's important for men as far as cancer screenings to have a colorectal cancer screening. It's really important to have a lung cancer screening. It's really important to have a prostate cancer screening. And these are all just screenings. And then it's really important to have a skin cancer screening. And it's not just important to actually have the screening, but it's important to follow up and talk with the doctor and decide with the doctor what your action plan is to make sure that you're trying to tackle the risk factors that you might have in your life that are alterable. So there are some risk factors for some of these things that can be altered that can help you to not have the higher risk of developing, for example, colorectal cancer. So when you talk about it, we know that a healthy diet and that's high in fiber is really important to the prevention of colorectal cancer. We know that as a community, if you look on the Center for Disease Control, you can see that some of the modifiable risk factors are being a healthy weight, leading a healthy lifestyle, making sure that you're making good choices in foods. So those types of things, those are things that we can change or that we can modify to make sure that we don't have that higher risk of developing those things. And so as far as lung cancer, the big one that we all know is being tobacco free. Super important, right? So making sure that you're not smoking, making sure that you're not using smokeless tobacco, and then making sure that you're not vaping, because those things can put you at a higher risk for developing lung cancer. And then as far as prostate cancer, we know that just general wellness is important for that. So making sure again that you lead that healthy, active lifestyle, making sure that your weight is where it needs to be, and that you are very aware of your own body. So, I believe that we're all born with this intuition or this intuitive nature where your body, if you listen to it and you listen closely, it can tell you when something's not right. And so listening to that is really important when your body, when you have that nudge that something's not right, to go to the doctor and make sure you have an evaluation and let them know, and be very transparent with them and honest about what you're feeling or experience, and telling them everything. That's the most important thing. I will tell you, as a nurse, in my career, the times that I struggled is when we had somebody who would tell us only part of the story, right? So they wouldn't tell us all of the things that they were feeling, all of the symptoms and things like that. When you're thinking about your doctor and your nurse and your healthcare providers, they're trying to put together a puzzle. So if they're missing pieces, that can be very difficult. So I encourage everyone to make sure that you are giving those healthcare professionals all the pieces of the puzzle that they need to put it together to help you. And then, of course, it's important to talk with your doctor and make joint decision making on when you should receive your first screening for each of these screenings, and then how often that those screenings need to be completed. And then important preventative testing and screening. So some of these screenings may be completed depending on your health history. I think almost everyone gets their blood pressure screened at multiple appointments. I even went recently for an appointment with an orthopedic doctor, and they checked my blood pressure. So I thought that was really good. It's important because your blood pressure has an effect on like everything in your body. So it's really important to make sure that, that your blood pressure is where it is, where it needs to be, and that you're in that, what we consider the good zone with your blood pressure. And then diabetes screening. I cannot even tell you how important diabetes screening is, because it can affect so many things in your body. So it can affect your eyes, it can affect your hearing, it can cause skin and muscle issues, it can cause urinary issues, it can cause changes in blood vessels. So it's really important to have a hemoglobin A1C, or to have a fasting blood glucose done. So just to make sure that your blood glucose, your sugar level is where it needs to be. That's really important. And then cholesterol and lipid testing, most of us have that done. I know they even check cholesterol and lipids on children at their 2-year-old appointment now, just to make sure that their cholesterol is where it needs to be, which is really good. By doing that, we're teaching children early on that it's important to be aware and pay attention to their health. And so, if they start that young and it's just part of that annual wellness visit, it just continues on, and hopefully they'll keep that up as they become adults. It's really important for our heart health. We talked about how heart health can be the #1 cause of death in men. So making sure that their cholesterol is on point, making sure that lipids are where they need to be is super important. And again, diet plays into the cholesterol and the lipids as well, and so does genetic factors. So somewhat modifiable, but also there are things about it that are not modifiable. But just knowing and being aware is very important. And then BMI, so our body mass index, is super important. Making sure that you're working with your doctor to see where you need to be on that chart. There's a range. So just working with them to make sure that your body mass index is falling on that range where it needs to, for you to be the healthiest you can be. And then last but not least, and actually very important, is depression and anxiety screenings. I know a lot of times when you go to the doctor, they will do a screening for depression and also for anxiety now, which I absolutely love. I think that's fantastic. But I will tell anybody that I talk to, those screenings are only as good as the person answering them's honesty, right? So sometimes It requires you to kind of let your guard down a little bit and be very transparent and honest with your nurse or physician to let them know, yes, I've been having some of these feelings, I've experienced some of these symptoms, so that you can talk about it and come up with an action plan. People sometimes think, oh my gosh, if I answer a certain way on this, they're going to automatically put me on a medication or make me go to therapy or make me do this or make me do that. What you need to know is you really need to have such a good relationship with your physician and the nurse that you see, that you can be very transparent, honest, and open with them, and you can jointly make decisions that are the best for you and your family. And so now we'll just talk about leading a healthy lifestyle. Really important to eat a healthy diet. And this actually applies to everybody. So no matter age, gender, no matter what, we all need to eat a really healthy diet, well-rounded, balanced diet, low sodium, low unsaturated fat, high fiber, plenty of vegetables. Can't stress that enough. So I think about vegetables and fruits as they're cleaning foods. They cleanse our body. They give us the nutrients and the vitamins we need. They give us energy. They have those really good B vitamins and C vitamins in them, and they help us to feel really good. And then lean proteins. That's really important, making sure that you're making really good, lean, healthy protein choices. And then also, again, developing that trust and relationship with your physician. Cannot stress how important that is. You should really be able to literally tell your doctor anything that comes to your mind without judgment. It should be a judgment-free zone. It should be a safe place. You should be able to just discuss whatever needs to be discussed with your doctor without any kind of hesitancy. And then leading an active lifestyle. So what does that look like? 30 minutes of activity a day. There is a recommendation from the CDC that we participate in cardiovascular type fitness, right? So you want to get your heart rate up. When you get your blood pumping, it helps to clean your arteries and your veins and get things moving. That's really good. It gets good blood flow to all of your tiny little areas in your body, your fingers, your ears, your toes, all these places you want to get it to. So that's really good. But that can look different for different people. When I say 30 minutes of activity a day, it doesn't have to be, running, it doesn't have to be jogging or getting on a treadmill. It could be chair exercises, where you're moving your arms. It could be strengthening or stretching exercises. It could be yoga. It could be some meditation, mindful meditation where you stretch. So all of those things count. So when you're checking the box, you can check the box on that one if you have some activity. And then self-awareness and self-care. Those are very important. It's important to make sure that you are very aware of what's going on with your body and that you're paying attention and that you're not dismissing things. I know we can all do that. We can just kind of, I'm too busy. I'm working however many hours and, I'm running around trying to get the kids to soccer practice and baseball practice and karate and dance and all the things we do now, right? And then we've got, maybe church or some community organizations we're involved with. So yes, those things are all important, but if it gets to a point where they're dominating your life and not allowing you to do the things that you need to do to make sure that you're healthy and well, then it's no longer, a good activity, right? It's now become a chore. And so that's not fun. So you want to make sure that you're just being aware of that and giving yourself the love and the care that you deserve. Then I have a slide here on questions, but before we jump to questions, I did want to talk about a couple of self-care things that we can do. So men in particular are very tactile and very active, right? So they like to do things that engage them sometimes physically. So a lot of times it might be, doing some woodwork in the garage, or it could be building something, or, sometimes fellas, maybe have a motorcycle or a car that's important to them. So working on those things, or it could be that they like to go hiking or a bike ride, or yoga. But the things that I want to encourage too, that we don't always think about that can be self-care things, are mindfulness. So just teaching yourself how to take that calm and cool, collected moment and in specific think about things and being mindful of certain things. And then maybe listening to music. That's a good one. That's a good way to perform self-care. Reading a book. I don't know if anybody on here listens to podcasts, but that can be a really good self-care activity. It can kind of help take your mind away for a few minutes. And then another one that I like to do is reflecting on things that are important to me or things that I'm grateful for. Those can be very helpful. Another self-care thing is making sure that you're practicing a healthy sleep hygiene. So making sure that when you are getting ready to sleep at night, that you make sure that your bedroom is a good welcoming environment, making sure that it's not too bright or likewise too dark, making sure that it's comfortable and that it's not a room of high activity. Studies have shown that people that engage in activities in their sleep area, so having TVs and computers and things like that, your brain never gets to really rest. So it's important that you try not to do those activities in that room of the home, that you reserve that room strictly for sleep. So that's really important. Does anybody have any questions, or do we have any discussion?
Brandy, I actually have a question for you. And as we were going through the slides, I really kept thinking about what you were saying and how important that primary care doctor relationship is for all of those things. So for me, even as an adult professional, I've changed primary care doctors a couple of times just from moving. When I was a kid, my family had the same doctor, like all of us had the same doctor. And that's really not how it is anymore. So I was wondering if you had some ideas or advice about how to pick a primary care doctor that really fits with you. I mean, I think there has to be some chemistry or connection there. I don't know if chemistry is the right word, but there has to be something there. And especially if you are a person of color or LGBTQ population that's really looking for a good fit for a primary care doctor, like what advice would you give to someone to find a doctor? Because, even the past community cafes that we've had, we've identified that primary care doctors are gatekeepers for all of these things.
Yeah, that's a really great question, Katie. So I will tell you what I did that worked for me. So I did my homework is what I did. So of course, I asked friends and family. I wanted to think about or try to find a provider that I thought mirrored myself, right? So I knew going into it, I wanted, and this is just me personally, but this is how I did it. So this might help guide anybody on how to do it. So I was like, okay, I know I want a female provider because that's how I would feel more comfortable. So I started searching for that and then narrowed that down. And then I knew that I wanted to try to find a provider that had experience in the chronic health conditions that I personally have. So I researched that. I looked at where the person or persons that I was looking at had went to college and the things that they had their study in or their concentration in. And then another thing I did, and I know this sounds kind of outlandish and out there, but social media. I wanted to know genuinely what was the experience with these providers. And so I literally typed out each provider's name and wanted to know if anybody that was my friend on social media had had any interaction with those providers and what their thoughts were on them. And being that I'm a nurse, of course, I have nurse friends, and I got some private messages that were like, no, 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 not that one. And then I got some that were like, yes, this one's a really good one. And I think you'll really like how this provider practices. So that's just some tips that I have. It's important to make sure that that provider, fits that bill of, do they see things the way that I need them to see them, so that we can, get on the same page and I can have that good relationship with them. And I say interview them. You can always go for that first appointment to get established. And if it's not the one, don't be afraid to say this is not the one. You can definitely schedule another appointment and go in for another visit, for sure. Any other questions or comments?
Brandy, I have one more for you. This one's going to be a little tricky.
Okay.
So I think we all have men in our life that are like, we're never going to the doctor, not going, not doing it. That's just not, it's not for me.
Yep.
So what advice would you give to us women that have some stubborn men in our lives that, they're just not fans of going into get medical treatment?
So that's a really good question, Katie. And I'm going to tell you what can be done early on with males, like when they're children, to help prepare for that. So I am the mom of 3 boys. And so being a nurse, I wanted to instill in them from the word go how important it was to have a primary care physician. And so I made sure from the time they were children all the way up until adulthood, because they're adults now, I made sure that they went for their annual wellness visits. I made sure they went to their dental appointments, their vision appointments, and I wanted them involved in their care. So when they were teenagers and it came time for vaccinations and immunizations, the doctor would try to hand me the paperwork on those to look and read over before they give you the vaccination or before you decide to have it. And I literally handed it to my 14-year-old and I said, you need to read about this, and see if this is something that you're interested in. And I think at the time it might've been like a flu shot. And so I started small, because we all know generally, most people do need a flu vaccination, right? So I handed them the paper and I had them read it. And then we had some discussion. We had some discussion with the doctor, and ultimately I allowed the decision. Now, with that being said, you have to be prepared that your child might make a decision that is not the decision you would want, right? So, but I think when they get to be 14, 15, 16, we have to guide them, but allow them to have some shared decision making. So that's important for males growing up, to teach them independence. Now, on the flip side of that, for those of us that have husbands, brothers, fathers, cousins, that we want to get those checkups and things done, that can be really tricky. And so, I think the best way we can do it is to ourselves demonstrate how important it is to get those screenings and those wellness, going to our annual checkups and making sure that we're doing those things right. So we have to set that example. But then on the other side of that too, I'm just going to go with old fashioned nagging. So you have to educate them, right? And teach and kind of guide them and let them know that you care about them and you love them, and that you really want them to have these things done so that you can make sure that they're well to help you, because you need them to help take care of you, and that you need them as, the person that you love in your life, and you don't want to lose them. And there's things that are able to be prevented. And so you want them to have these screenings and these things done to help prevent a complication or a problem later.
Thank you, Brandy.
No problem. And so there's my contact information. If anybody, later has a question, feel free to reach out to me. I'm happy to talk with you via email or phone, either way. I don't mind if you have questions and things. So feel free to take that down and keep that in your little contact list so that you can reach out to me if needed.
Thank you very much, Brandy, for that presentation.
No problem.
2 big takeaways for me. One, I probably need to change my bedroom a little bit and get a TV out. Not sure that's really going to happen, but I hear you. But the other good takeaway is I'm not so upset that I play my loud music on my deck anymore because that's my release moment. So
Absolutely.
thanks for reinforcing that despite what my neighbors may think. So
You can say Brandy said it's okay. I'm just kidding.
there you go.
They'll say,
So,
who's Brandy?
so our next speaker is Leslie Deal. She's with OPT Out. She is the program manager at Carolina's Care Partnership. And Leslie, I know you want to share your screen, and thank you for joining us. I know you were jumping off one meeting onto this one, and welcome you. So you can share your screen and manage the slides. That's probably easier.
Yeah, I'd love to. And I'll also, I want to apologize. I'm not going to go into great detail, but I was out yesterday with food poisoning and I am recovering slowly but surely this morning. But you can see like my face is it's a mess. So yeah, I was out of the office yesterday, but I'm happy to be joining y'all today back in the office. And Brandy, I caught the tail end of your presentation. And much to the dismay of my partner, I do not allow televisions in the bedroom. I never have. I was raised in a home with no televisions in the bedroom and we don't have them. My partner was like, don't you think we should just get a television? Because then we can stretch out and watch it. I was like, no, because then it'll be on when we're trying to go to bed. And no, it's a no. So there's no TVs in my bedroom, but good. I can tell him that a medical professional told me today that I was doing the right thing and he can get over it.
Yep,
So,
blame it on Brandy.
with that, I'm going to, and I hope, okay, can y'all see my screen? Okay, Brandy and Jerry, I can see, and I keep going in between being hot and cold. I think it's left over from the food thing yesterday, so I'll probably put my jacket on and take it off a million times, and I hope that doesn't bother anybody. So my name's Leslie. I use she, her pronouns, and I am the program manager for Opt Out with Carolina's Care Partnership. What I've been asked to share about today, and I'm going to do this very briefly because this is typically over an hour presentation, but I'm just going to go through the highlights sort of in the next 15 minutes. This is a program or a presentation, I should say, that's in coordination with partners. I work with Starla, who serves different counties for partners, and I was helping them sort of like plan out the different presentations that they were going to be doing this year for crisis intervention training, the CIT that they do for first responders. And I was like, have y'all ever had like a conversation about language as an intervention for a crisis situation? And not really. I mean, I think that some of the presentations do sort of hit on language as a means for diffusing crisis situations and sometimes even preventing them. But since a lot, and I'm going to tell you guys about the project that I do very briefly because it relates to what I'm talking about. But language is a big thing, and I think it's like 30% of our communication is verbal and like 70% is nonverbal. So not just language that we use, but our body language that we use also in these types of situations. Is this going to let me? Okay, so I'm not going to go through all of my introduction, but I typically go through an introduction because a lot of the things that I've done have sort of gotten me to where I am today. But one of the big things is that I was at UNC Charlotte. My background is in higher education. I was there for 12 years before I made the switch to the nonprofit world. And I've done a lot of work around sexual and reproductive health and also LGBTQ topics in the community and on campus and beyond for that matter. Okay, so for those of you who don't know, Carolina's Care Partnership is located in Mecklenburg County, but we serve a 10-county catchment. So that's 7 counties in North Carolina and 3 in South Carolina. So Carolinas is plural, not possessive. I say that pretty often so that people understand. But we do a lot of work with housing and specifically housing for people who are living with HIV and 80% below the median income. We do testing in the community. We have housing case managers, medical case managers, mental health counseling. We have counselors in the office. And then my program, which is very different than all of that, So SAMHSA is funding this 5-year project, and we're looking at the intersection of LGBTQ youth and young adults and people living with HIV and opioid use and opioid misuse. So we're trying to decrease stigma around these identities and also decrease stigma around opioid use disorder and try to increase access to care, and whether that be prevention, treatment, harm reduction, what have you. So that's just a little bit about just a very small snippet of what we're doing. I think I sent these to Jerry, but a lot of times, you know, even when we're talking about first responders and just in the work that typically people do, sometimes it's not really allowed to just sort of like let people know that you support the LGBTQ community by like waving your rainbow flag. So what are things that you can do and things that you can say to show your support for the community without actually being like, hey, my name's Leslie, I support the LGBTQ community, you know, what can you do? And then, you know, understand why inclusive language. And I'm going to add into inclusive neutral language. That's important. Some of you probably noticed whenever I introduced myself as Leslie and I use she, her pronouns. It's important that, so for someone who's cisgender, like I am cisgender, cis means same, it's important to show support of the trans community by showing that it's okay to use whatever pronouns that you see fit for yourself. So I chair a task force that's comprised of professionals from 10 counties, and I always encourage them each time to change their name to show their pronouns, introduce themselves with their pronouns in the chat and things like that. And it creates a safer space. And I actually have some really great research, an article about pronouns and their importance, if anyone's interested in that later. I did come on, as they mentioned, I was in one meeting and hopped over to this one. So I did come on a little late to this meeting, but in the chat, I put my name and also my email address. So if anybody has any questions or follow-ups that we either don't have time to ask now, or you don't want to ask now, or what have you, I'm extremely responsive to email. However, I will tell you, I'm only in the office until 3 today, and I'm fully booked today. And then I'm out of the office for my 40th birthday, which is not until next Tuesday, but I'm going out of town. So I'll be out the 23rd through the 29th and back in the office on June 30th. So if you email me, there's going to be a delayed response, but normally I'm really quick to respond to email. So feel free to reach out if you have any questions. That is specifically related to police. So I was going to skip over that, but and some of these, so what I'll say about language is that language is ever changing. And I think that's why a lot of people have issues with it, because there's always like a new, like latest and greatest term. For instance, some of you may know about the term BIPOC and others may not. Even though BIPOC has not been around for a super long time, there's already people who don't like it. So, but BIPOC stands for Black, Indigenous, People of Color. I actually heard somebody in a different presentation the other day refer to it as QT BIPOC, which is queer, trans, Black, Indigenous, People of Color. And it's sort of a way to pull together like many different identities into one acronym that talks about disproportionate effects of health, you know, health outcomes, and just, you know, overall just not living with privilege if you fall into one of those categories. Also, we know people with varying abilities or disabilities can be disproportionately affected by these things. LGBTQ people. Oh, I'm sorry. Did somebody have a question? Or was that me? It might have been me. Okay. I don't have a question, but I heard some feedback. And then also you'll hear me use the term queer sometimes, and depending on which generation you're from or whatever your lived experience may be, to some people queer sounds like a slur, but queer is a term that has sort of been taken in and re-empowered and loved by the community now. If you embrace a term, sometimes it can take away the hurt when people use it. Of course, it's all about the context in which you use things, but the way I describe it to people is that if someone introduces themselves as queer, it leaves the conversation open for them to further identify themselves. If I introduce myself and I say, hey, my name's Leslie and I'm a lesbian, you're like, oh, okay, I get it. She has relationships with other women. So I'm going to put Leslie in the lesbian box and she can just stay there. But if I introduce myself, hey, my name's Leslie, I identify as queer, you're like, oh, queer. What does that mean? What does that mean for you? And it leaves it open for people to ask more questions and sort of get away from this very binary way of thinking. And by binary, I mean like this or that, black or white, left or right. Like it doesn't leave any room for the continuum of feelings and identities that people have. So I'm not going to read all these to you, but it basically just says that people experience these things at a greater amount more often if they identify as queer, BIPOC, differently abled, disabled, living with HIV, using substances, and you folks probably already know most of those. So, and I shared, Jerry, I know that I had shared this as a PDF version with you. I'm pretty sure I did, and told you that you could share it with the community cafe. Is that true? Did I share this with you?
I honestly am not sure. I'm not
Okay,
sure.
I
But
will. So whenever we get off of here, I'll send this to you as a PDF. And that way y'all have this, because we certainly do not have time to go through all of this today. But it's got a lot of sort of like more affirmative terms versus not affirming terms. And that's where we want to be. Now, I have heard a couple of people, because I always talk about person first language. And by person first language, we mean you talk about the person first and then the attribute. So it's a person with a disability, or a person who has a traumatic brain injury, or a person with a substance use disorder, not like a disabled person or an addict or things like that, which you've probably heard of that before. There are some communities that I have heard from the communities, from people that have lived experience, they do not want person first language. Two that I know for sure are autistic people. They don't want to be a person living with autism. They are autistic, and it is a large part of their identity, and they don't want person first language. I've heard this from advocates for the community. They're like, Leslie, stop with your person first language. We do not want it. So autistic people, they're autistic. That is it. The same is true for trans people. If someone is trans, they don't want to be a person with trans experience or anything like that. They identify as trans. They are trans. That is it. One I heard the other day is also the deaf community. On here, you see it says person who is deaf, and that's fine. But I've heard from several people within the community that they are deaf. Like it's the deaf community there. And, you know, it's sort of like a sense of pride and community and belonging. And so I see that. And so what I tell people is that, you know, it's all about your intent, and people will feel your intent. I mean, I've been doing work, you know, with the LGBTQ community and around language for 2 decades now, and I still mess up. But they know that that's not my intention. My intention is to do whatever is going to make everyone feel wonderful and bright and beautiful, but I'm still going to stick my foot in my mouth. And so just encouraging people to, you know, speak up about, you know, words that they like or don't like, especially when you're serving them in whatever capacity, encouraging them to say, you know, how they feel and how they want to be referred to is important. And like I said, language changes every day. My mama, bless her, she passed like 2 years ago. But even though I told her over and over again that it's okay to say Black people, she always said colored people. And in her mind, because of her generation, that was her being kind. She didn't, you know, Leslie, I went to the grocery this afternoon and, you know, that really nice colored lady. And I'm like, Mama, what color is she? You don't got to say colored people anymore. It's fine, you know, but, you know, so everybody comes from different lived experience, and what might be the nice thing to say for some people isn't the nice for everyone. And that doesn't mean that it's like an assault on you as a person. And so, you know, I try to think that everybody's coming from a place of good intention. The gender unicorn, I could literally spend an hour just on this image, if not more. But what I will say is that there are differences between gender identity, expression, sex assigned at birth, and then attraction. The way that I've referred to it in the past is if you think about it in terms of clothing, in this case, pants, and I hope this doesn't confuse anybody, but sex assigned at birth refers to what is in your pants. And then identity refers to how you feel about what is in your pants. And then expression is how you wear your pants. And then attraction refers to whose pants you want to get into. And so it's all different. And it can be, someone can be, female assigned at birth, and then they identify as male and express as male, but then they're attracted to women and then they identify as straight. So like if you're not familiar with it or you haven't had these conversations before, it sounds very confusing. But like I said, shoot me an email after June 30th. I'll be happy to schedule a one-on-one with you and we can talk gender and the gender unicorn. I'd love to do that. Some neutral language whenever you're trying to be gender neutral specifically. A lot of times when I'm sending out emails, I'll say, hey, y'all. And sometimes people think that's unprofessional. I use y'all because it's gender neutral and I'm from the South. So if you don't like it, just, I don't know what to tell you. Saying they is a difficult one for people. When people use pronouns that are not he, him, his, or she, her, hers, and they use they, them, it doesn't roll off the tongue very easily. I can tell you that. And whenever I know someone uses they, them pronouns, I still feel strange using them. And a lot of times I just use their name. People are often like, oh gosh, what if I don't know? And I'm like, use their name or ask them what their pronouns are. That's actually another reason why I say, hey, my name's Leslie and I use she, her pronouns, because it makes the other person not feel weird when they're like, hey, my name's Chris and I use he, him pronouns, whatever. So we are definitely not going to have time to go through all of this, but just remember substance use disorder, get away from using the term abuse. And that's hard because like our funder is SAMHSA, which is Substance Abuse and Mental Health Services Administration. So they're still using it. And I feel like that's going to take an act of Congress, literally, they are the feds, for that to change. But, saying that someone has a substance use disorder, I think that most of us on this call are probably already aware of these kinds of things. My background is sexual health. And so I would ask people about getting tested and they're like, oh no, I'm clean. And it makes you feel like if you have a sexually transmitted infection that you're dirty, or if you're actively using substances, then you're dirty. And so anytime we attach that sort of stigma, that value to a behavior, people are less likely to get the help that they need because they already feel stigmatized for their use or for their activities or what have you. And so we're trying to get away from that. One that I hear pretty often that I do want to say also is committed suicide. We want to say died by suicide. You never want to say committed because it makes it sound like they've committed a crime. It adds this value of, it's negative. So died by suicide, attempted suicide, things like that. Another one that I want to be sure to mention is that when you're talking, and I have to, heavens, when you're talking about people in the United States who are undocumented, they are undocumented. They are not illegal. Humans are not illegal. So saying that someone is illegal would not be the neutral and way to say it. You would say that they are undocumented. But this is a really great presentation, a really great slide deck with a lot of, instead of this, use this type of language. And Carolina's Care Partnership, we're currently working on our neutral and inclusive language policy for our organization. I would be more than happy to share it with you all if you are looking for a language policy for your organization. I'm planning as part of one of our work groups to draft up a one-page policy document with supplemental attachments where you can use that and make it your own. And Jerry said also for suicide, yes, successful suicide, yes. Or yes, successfully completed suicide. I've heard that also. So yes, it's died by suicide, attempted suicide, things like that. Thank you. Okay, so my next meeting is already here. So I'm going to, it's been one of those kinds of days. My partner also, I regularly try to make everything very neutral. And so we were in Florida a while back at his mom's place. And I said, oh, look at those fisher people coming into port. I bet they have lots of good shrimp. And he was like, Leslie, fisher people is not a thing. And I'm like, but fisherman is gendered. So we're going to fisher people. And sometimes I might take it a little too far, but again, it's with good intent. Like it doesn't have to be, everything is so gendered. Also, if you've heard the term Latinx, and some people in the Latino community appreciate that and some people don't like it. Again, you're never going to find one term that fits for everything, but the idea behind Latinx is that it's the gender neutral form. So you're not saying Latino or Latina, it's Latinx. I also heard someone the other day who works with the ACLU say Latine with an E on the end instead of Latino or Latina. So Latine, that would be gender neutral. So we're trying to find neutral terms. It's difficult with a language like Spanish where most of it is gendered. But anyways, that's that. Okay, so I'm gonna have to wrap it up. And like I said, we didn't even, barely touch the surface of the whole presentation, but that's it.
Thank you, Leslie. You know, Leslie did a presentation for one of my collaboratives, and I think I gave her a month's work with the follow-up emails she got related to wanting her to go into greater detail about it, which that's not a bad thing. And I know Leslie's got to run, so doesn't really have a lot of time for Q&A, but she did put her contact information in the chat box. I do want to, before turning this over to Katie to close us out, and, you know, if there's any brief questions, please put it in. But I did want to say that we felt when we talked about this being a part of self-help, we thought it was very important because language matters. And, you know, and Leslie mentioned she does the CIT training, which is crisis intervention for our law enforcement. And we're working on hopefully bringing that to other areas as well. But, you know, if you think about the language you use with someone that's in a crisis, what you say or don't say can influence what happens next. And I think we don't necessarily always pay attention to that, especially when thinking about those officers that have to make a split-second decision, and what they say or do matters so much. We hear about it in the news all the time. And, you know, that is why Leslie's a part of that, to try to help our emergency responders when they're responding. So I don't know if there's any brief questions for Leslie, but I'm gonna put her on the spot to make her hang out a little longer if there is. We'd really rather have you turn your camera on and ask your question. If not, you can contact her. And Katie, I'm done talking, so I'm gonna turn it over to you and Leslie.
Well, I will say it's awesome too, being in those spaces, because the first responders, the EMS, the police, they share about situations that they've had, you know, with, you know, where they're taking someone in for an emergency and they identify as a man, but the issue that they're having is gynecological in nature. And then how do you be respectful of a person and their identity when it doesn't fit with the issue at hand? And, you know, so they're on the radio, you know, talking about this person and their body that they don't, it's a lot. And so what's really great about these sessions is that we have time for them to talk through that, you know, and to talk about their experience and what we could have done differently or better. Hi, Alicia, I see your hand up.
Hi there, Leslie, I appreciate your presentation and thank you for the diligence to really open up the conversation and create dialogue. One of the things that I've always advocated for that can get past all of the preconceived ideas is to simply ask, how would you like to be addressed? How would you like to be identified? And would you mind telling me a little bit about yourself? And when we take that step, we don't have to go through knowing every pronoun or adjective. We allow them to identify more fully, and then you actually have an engaged conversation. But I really thank you. I think this is awesome work.
Absolutely. Thank you, Alicia. I appreciate that.
Thank you. Thank you all for coming and joining us again this month. And we hope you come back. We have some really cool community cafes planned coming up for recovery and suicide prevention. We're also going to dive into healthy opportunities a little bit. So bring your friends, share the link. And if you have any questions or if you need us to help you with anything, please reach out to any one of us. We will personally help you out, make connections. Jerry's a walk and Rolodex, and Brandy is well connected in the medical community. So we're here to help you personally and to help the people that you're serving too. So please don't hesitate to reach out to us, and we hope to see you again next month.
Thank you. I enjoyed spending time with y'all today.
Katie. Okay. Here's the thing. This is